And welcome back to the show. For nearly 50 years, mammography has been the primary tool for detecting breast cancer, contributing significantly to the decline in breast cancer deaths since the year 1990. Now, studies indicate two-thirds of this reduction is due to mammography screening. Understanding the facts about mammograms could actually save lives. And joining us and sharing further information, we've got the medical director of women's imaging for the National Radiology Provider at RadNet. We're pleased to have Dr. Jacqueline Holt back with us again. And Dr. Holt, good to have you.
Good morning. Good to see you again. Thank you for having me.
Good to see you. And when we talk about mammograms, obviously, for some people, it's a word that a lot of hesitancy. But the reality is that in order to stay healthy, really, mammographies are really essential in the life of a woman.
So I'm really glad to hear that you brought up mammograms have been saving lives for 50 years. And I think there's a very interesting piece of information regarding the studies that proved that mammography was saving lives were done in the 1970s and 80s. And these studies showed good results, but they can never really be repeated again because they were randomized controlled and you were putting women into groups where they get mammography or don't get mammography. And because there was such efficacy, everybody started to recommend mammography. Now, the important thing is that these mammograms that were done 40 years ago or 30 years ago, we have come such a long way with technique and quality. It's almost night and day. So that the fact that these studies showed such a good reduction at that time, and we're doing much, much better. And including with what is hitting now, which I think is kind of revolutionary, it's the artificial intelligence, which I think is the future for mammography also.
When we talk about the future of mammography, we are projecting that things will obviously get better. And the reason why is because we know that more and more people are getting screened and more people are taking advantage of these screenings. But let's be honest, there's still this thing called mammography hesitancy. There are people who have hesitancy, people who are trying to debunk some of the myths and the stereotypes that are associated with it. But let's talk about what are some of the myths that I think that maybe we're having when it comes to mammographies and the exams to keep people from getting into your office.
Well, I'll start with I'm going to end with what I think is one of the most important myths. But let me start with there's ideas that it hurts. It is compression, and the more compression decreases the dose. And it's only for about 3 seconds that you're in any one image with that compression. So I would call it uncomfortable, not painful. Radiation, there's just to put it, if there's hesitancy regarding radiation, there's radiation all around us on the planet. We are just getting radiation constantly just from living on the planet's surface. So a mammogram is equivalent to approximately 7 weeks of just living on the planet. So it's very low dose, and the harms are very low and from radiation, and the results are very good for getting a mammogram. One thing that I hear women say is, I have no family history. I am not at high risk. And that's a misconception, in that the vast majority of women who get breast cancer have no family, no history in their family for breast cancer. So leading into, when do we begin screening? And these studies that were done 40 years ago that we rely on all show favorability of starting at the most lives are saved starting at age 40, and then annual every year. What I think is very important important for our community is to realize our at-risk population are African Americans. They women in African American heritage have a higher mortality rate, 40% higher. That doesn't mean, 40% death rate. What that means is 40% higher compared to white women and women of Asian descent. And one of the things that we have found out that I don't think the public is as much aware of is that in the African American community, there are these higher risk cancers that are found. They're called triple negatives. And what triple negative means is that they don't have receptors for estrogen, progesterone, these hormones that our medicines can help with. So these are the more aggressive, these are the cancers that grow quicker and start earlier. African American women have, I'm looking at my statistics, I want to get this right. For the triple negatives, it's 21% in African Americans compared to their white counterparts.
Yeah. Let me jump in and ask this question here, because I think this is very important, because a lot of people self-diagnose, right? And we hear a lot of women go out and say, listen, I've self-tested, and talk to me about that self-test versus getting in there and getting your a real mammography.
Are you talking about a breast exam, like
Yeah.
feeling your breast?
Yes.
Yeah, the hand's a very blunt tool. Why I'll say, if you feel a lump, we should take that very seriously. So, but that is nowhere near as effective as mammography, and in fact, the latest recommendations do not recommend they recommend knowing your breast, but not this like monthly examining your breast, because it is so blunt and not really effective. Different if you go into your physician and they do a clinical breast exam, because that is more thorough. And another misconception I can lead into this is cancers can hide in dense breast tissue. So more important to have a good clinical breast exam by your physician along with the mammogram.
Yeah. And so, as we get ready to wrap things up, what are the main things that people need to know in 30 seconds or less, so that way we can send them home with some great information? Not that what
Um,
has been provided already isn't great.
Annual screening at 40. Um, Go to a center that has the highest resolution equipment, is doing 3D mammograms. And if you are able to get artificial intelligence applied, there is what we are seeing great benefit.
Yeah. Well, Dr. Jacqueline Holt, as always, great information. Thank you so much for sharing. I think it's important that people know the importance of mammographies, and also debunking some of these myths and stereotypes that can really hopefully get people into a doctor's office and potentially save lives. So thank you for.
Or just come to the center. Thank you very much. Have a great day.
Yeah, we want them to come to the center. Now, listen, if you want more information, visit the website at radnet.com. There you can get your way there, or follow them on Facebook at RadNet INC. We encourage you, don't go anywhere. We got more open coming up right after this.